Hi everyone, or one person, if anyone at all is watching this. It's kind of actually my first YouTube video. It's not the easiest thing for some people. In my case, it's really not easy. I'm not doing this to, let the world in on stuff necessarily. I'm just doing this to at least get my side of information out, so to speak, and hopefully can, bring some things to mind for others who probably don't have answers as yet. So basically, in a nutshell, my name's Michelle. I live in Florida at the moment. I'm 27 years old. I actually have, I'm sure as most people can understand and can relate, we've all heard, unless you've been living under a rock, you've all heard cases of, I believe it was Mary-Kate Olsen, Avril Lavigne, a prominent member of one of the Desperate Housewives cast members, who all have come down with the case of what appears to be Lyme's disease. For anyone who doesn't know that much about it, it originated, as far as we know, in Lyme, Connecticut, when a bunch of cases started popping up of small pediatric cases, and everyone thought that it was juvenile rheumatoid arthritis, and they were getting treated for it, and nothing was happening and getting any better. So then they were able to determine exactly what it really was. Lyme disease in general, especially if you know anything about it, if you catch it early enough, from what we're understanding to be from a tick bite, and you catch it, like I say, within a couple of days to a week, you're looking at about 3 to 4 weeks of an antibiotic called doxycycline, and then you're fine in most cases. However, further than that, or a longer wait time than that, you're actually looking at way more serious symptoms and side effects and everything. And we're talking nerve damage, heart problems, problems with the brain, neurological issues, severe pain throughout the entire body most times. And unfortunately, to top it all off, it also makes you incapable of having any success with a lot of antibiotics out there. Now, we're now starting to determine in some medical circles that it's also possibly sexually transmitted. Whether or not that's true or not, or whether it can also be maybe prevented through some means of protection, is still up in the air and a debate. I'm not sure about. I don't know. I've been told by my doctor that it is sexually transmitted. Not sure. I don't know. Saying all that just to say it's that. We're also determining that it could also be, parasite. It can be transmitted by parasites. And also, if you're pregnant and you happen to be infected, it can be passed on to through in vitro to your baby if you're not aware of it and you don't take care of it. Needless to say, it can also be passed through to breast milk. So, saying all that just to say, it's a very serious problem. It can cause debilitating. I don't think from the problem itself it's necessarily fatal, but I do know that the symptoms itself can be fatal. It can cause other problems. It can mimic a lot of other problems: lupus, arthritis, multiple sclerosis, all these different things that patients are coming down with symptoms of, going to their doctor, trusting to get adequate and accurate information, and the doctor's not knowing what to do. They misdiagnose them and mistreat them, if they get a diagnosis at all. Most times they're also told, well, your test came back fine, so you're fine. You need to see a psychologist. It's just not my field. Saying all that just to say, basically, I just wanted to, I guess, bring to mind other situations that I told myself I was going to do this at some point. I believe the public has the right to know, being that I live in South Florida, it's not considered a Floridian problem. It's considered something that normally happens in the Northeast. New England, New York, New Jersey, places, up in that region, and you go into the emergency room and they ask you what's wrong or any history of health problems, and you say Lyme's disease, and they look at you like they're the medical professionals, and they look at you and they're like, where did you get that, or how did you get that? And one of these days, honestly, I'm going to turn back to them and say, okay, you took, the medical tests and you did everything necessary. You tell me how I got it. Why am I having to educate you? But I'm serious, don't really do that. But basically, that's always been the question that comes up, and it can be really crazy. Anyway, sorry, I know I'm saying a lot. I'm just kind of winging this. I'm telling the truth, everything that I can remember. But I don't want to sound too rehearsed or like I wrote everything down. This is just me remembering details and bits and pieces. Again, like I said, because I started having problems from about the age 7, I started having pain in my left leg. It went off and on until about 11 years old. We were always told that it was juvenile rheumatoid arthritis and that I would outgrow it. I didn't need medication. I didn't need special shoes. I didn't need anything like that. And I would be fine. And this is actually when I was living up in New Jersey at the time. So we took that for what it was. It came and went until I got older and pain got much more severe, much more serious. I was literally having what appeared to be seizure-like episodes. For some reason, as disgusting as it sounds, when the pain would reach so bad in my body that for some reason, I guess some people pass out, some people scream, some people slit the wrists. Me, I had the lovely option that whenever it got to that point, everybody knew to keep a bucket nearby because I was always throwing up everything I could possibly try and have. So that was always a constant thing with me. My stomach was in very bad shape. They had me on steroids and all that good stuff. So anyway, that continued off and on throughout my adolescence and my teens. And there were a lot of issues with trying to keep up with school. I'm not a bad student. I'm not that you gain all your intelligence at school, because you don't. You learn through life. But in all honesty, I wasn't a bad student, so to speak. I wasn't, a knucklehead. I tried really hard. I told people all the time I worked really, really hard, basically to feel like I just stayed at the bottom. It was very difficult for me to do well. And one of these days, if anybody should ever be curious, I'll tell you a very interesting way the whole No Child Left Behind. They left me behind and they royally screwed me over out of getting my high school diploma. But again, that's another story. But just saying all that just to say it caused a lot of problems. I was in wheelchairs. I was using, walkers. I couldn't navigate on my own. I needed the most personal help getting to the restroom. Someone, mostly my mom stripping me down to use the facilities and to get me back up and everything. I didn't have anything to do with family. I was depressed. I was angry. I didn't like the way the meds made me feel. I didn't like the way I looked. All that good stuff. Saying all that just to say that by 17 years old, I went to a camp. I'd been to a camp previously before, also in Florida for children with chronic and terminal health problems. I went there as a camper a couple of years. Had a great time. It was wonderful. I would go back in a heartbeat. So that went really well. Then I went back again as what you call an LIT or CIT, counselor in training, at 17 years old. This is 10 years ago. At the time there, I actually remember maybe about a day or two into it, I was taking a shower and I freaked out because I found what appeared to be a large bug. It was huge. It was disgusting. I'm not scared of bugs. They don't freak me out, but like anybody, I'm not fond of them, and I sure as heck don't expect to find them on my body. And it was on my stomach. And what really frightened me was that I tried taking it out and it wouldn't come out. So I'm pulling and I'm pulling and I'm scrubbing, and it was not doing that. And that's when I really started freaking out. So I called out to one of the other female counselors, and I showed it to her on my stomach. I was told a couple of different reactions by different people. One person said, oh yeah, that's a tick. Get a pair of tweezers and pull it out. Another person said, take it out and rub nail polish remover on it. And another person said, no, you need to take that out and you need to go to, and they said the name of what we call the on-site hospital. Again, this is for camp for children with health problems. So to go there and for them to see it, it's very important. Now again, it never occurred to me at 17 that I needed to go rushing to the hospital, so to speak, for something like a bug being on me. That seemed absolutely ridiculous. So I'm like, no, I got this. It's not a big deal. I can totally take care of it myself. And I went ahead, and it took a little work, frighteningly enough, but I eventually did get to pull it out, or pull what I thought most of it was. Not to gross anybody out, but it was like literally maybe the size of a grape. It was gross. I don't know how I did not see that. I showered, especially being at camp. I showered 2-3 times a day. So it's not like there was ever a time that I didn't not notice it. And for some reason I didn't see it. But I got it out, no problem, threw it away, shook it off, felt disgusting, felt like I was going to puke, just the sight of it, but I was fine. No problem. Within about 2 or 3 days later, I think that thing had to have been on me for a little while, because within about 2 or 3 days later, I broke out in a rash all over my chest and my body. I was feeling just I was used to having pain, but this was a different kind of pain through my whole body. I was feverish and sick and sweaty and gross, and I couldn't breathe. It was really bad. So it got to the point then, like I said, 2 or 3 days later, where, again, it never occurred to me it was because I got bit by something, and I found myself needing to go to what we call, the on-site hospital there at the camp. And I went, and because of a turn of events, when the nurses first saw me, they were very concerned. They had me up on oxygen and IVs and all that stuff, and started, giving me fluids and medicating me. And then I had a doctor that I had seen as a youngster, and because he was taking care of me when we thought it was juvenile rheumatoid arthritis, and all my tests kept coming back negative, but I was still complaining of pain, he started to consider me basically a hypochondriac, and that there was nothing wrong. And I think my video is going